Welcome to On the Brink with Andi Simon. Thanks for joining us today. As you know, in all of our podcasts, my job is to help you become a little like an anthropologist. I want you to step out and look at yourself or your business and rethink what you're doing. Think about it through a fresh lens. Understand what other people have done and learn from them. Their stories are going to help you change your story. And remember, we live our story. So, whatever is in that mind of yours about who you are and how you're doing it, my job is to tell you think carefully. I want you to see, feel, and think in new ways because sometimes there's an opportunity right in front of you. And our job is to turn all your observations into big innovations, like our guest today has done. So, welcome, Delia Passi. Delia, I met at an Entrepreneurs of Purpose session that we held through the Women Business Collaborative in Washington, D.C. at the beginning of March. It was wonderful. She presented something she's doing to help people, you and me, better manage our medication, but also our care. Let me tell you a little bit about her, and then she'll tell you her journey. Because the journey is much fleshier, much more interesting when they tell it to you themselves than when I read their bio. But here's who she is. Delia Passi is a seasoned entrepreneur and advocate for women's health, renowned for her innovative contributions to healthcare technology. It's really wonderful. She is the founder and CEO of MyCabinet, a virtual medicine cabinet designed to streamline medication management for families and caregivers. Now, the inspiration for MyCabinet came, as so many of these do, from experience. She was managing her elderly parents and their complex medication regimens, highlighting the need for a user-friendly solution in the caregiving landscape. Now, this is really interesting because all of us at some point have managed our parents, and we didn't realize how complicated it was growing older and having someone else help them stay healthy or at least manage the medications they need to get healthy. Before launching MyCabinet, Delia held the position of publisher at Working Mother magazine, where she played a pivotal role in the success of the 100 Best Companies for Working Mothers list. Her tenure there underscored her commitment to addressing the needs of working women and advocating for family-friendly workplace policies. In 2010, driven by her own battle with breast cancer and the challenges she faced navigating the healthcare system, Delia founded the Women's Certified Inc., home of the Women's Choice Award. The initiative aims to empower women to make informed healthcare decisions, and it recognizes hospitals, businesses, and services that meet high standards of excellence and are recommended by women for women. Her dedication to improving healthcare experiences has been recognized through various accolades. She was named a runner-up in the Dell for Startups pitch competition. Her work continues to impact the lives of countless individuals, providing tools and resources that prioritize health, wellness, and informed decision-making. Here's the situation of a woman facing all kinds of tactical issues, who comes up with a purpose-driven company that's different. It isn't simply about giving back. It's not about volunteering. It's not about doing good things, although she does those. This is about a business that has a purpose that matters so that she matters as well. Thanks for joining me today.
Thank you, Andrea.
Tell the listeners about who you are, about your journey, and make all of this come alive. How did you get to where we are today? And then we'll talk about MyCabinet and what you're building here.
Well, I'm appreciative of the opportunity to share my story, but also to inspire others to think about taking this journey of becoming a purpose-driven organization. So I'm a three-time exited entrepreneur. I built publishing and media companies, and I've sold three of them. I'm very bottom line driven. I had investors all my career throughout my career and boards that demanded a lot. Most of it was bottom line. And that's the only way I knew how to think, right? How do I build a profitable company that will make people a lot of money? Well, I've done a good job of it, and I will tell you that the journey was rewarding in the sense that I secured my retirement, my children's future, but I also made a lot of people happy, right? But there was a turn, there does come a point in your life And it happened to me with my mother. But there does come a point in your life where you go, is that enough? And can I do more? And am I done? And what's next? And so I was at a point where I was thinking about retiring. I actually have another company, a healthcare marketing company that is now we're looking to sell it. So that should be sold probably in the next 12 to 18 months. And that's done a lot of good. Many of you have heard about the Women's Choice Award, that we look at the best hospitals, the best doctors, the best everything. We make it easy for women to make good consumer choices. I built that out of a purpose when I was diagnosed with breast cancer. And I couldn't find any resource to help me evaluate one breast center from the other. So I changed that by setting the highest standards of breast care in the world. So we worked with leading hospitals and so forth. So I did feel good about that. I always felt like, I helped truly millions of women, because that company's been around for 15 years, help millions of women find the best breast care in the country and set standards which hospitals and breast centers and mammogram centers work hard to reach, because we award them, right? This designation. So very proud of that, because I know we've made a contribution. But I really never thought of that as a purpose-driven organization. I thought of that as doing good, right? My brand does good. It helps people. It does the homework for them. So I'm going to help spare women by making the right choice versus costing their lives by making the wrong choice of where to go. And by the way, in healthcare, if there's a piece of advice I can tell you is before you go anywhere, please go to the Women's Choice Award and see how we rank every hospital in America, breast center in America. Because honestly, I've seen too many times unnecessarily, from maternal deaths to, breast cancer deaths, and so much of it has to go down. Really boils down to treatment. So that's one thing I really feel really proud of. But that still was never formed to be purpose driven. It was just a good company that did good things. Very different. And I hope that this podcast will help people understand the difference.
Yep.
Because so many of them sitting here are going, well, I have a company that does good. We help people do this. We help teachers do this. We help employers do this. We're doing good. Yes, you are. And good for you. And you can go to sleep at night knowing that, you're making a difference. So congratulations. But purpose is much deeper than that.
Well, much deeper has lots of meaning to it. And I know you're going to dig into it, but I don't want to discourage people from finding a pathway to have a purpose to matter their way. But I also want them to hear what you discovered, because I don't think this was without deep meditation, concentration, thinking about what does the word mean? What do I personally want to contribute? How can I make business different than simply a bottom line? Please share with us.
So well, my cabinet was I am probably the furthest away person. Anyone who knows me knows that I can't even get a TV remote to work. So running a technology company is God's, playing a little, good sense of humor. Let me put it that way, right? But when my mother, and by the way, there will be a video on this on the podcast or the blog that I really encourage you to watch. You'll see the experience that I went through with my mother when she was rushed to the hospital, and I was 200 miles away, no access to her home to retrieve all her medication. And when they're rushing her to the hospital, they're on the phone with me because she couldn't speak clearly. She was having a massive heart attack. What meds was she on? When did she take her meds? What is she allergic to? I thought I was myself going to have a heart attack because I thought, that's it. I'm going to kill my mother, right? So I didn't know. And that left me with a very difficult positioning. That left me with a how can we make sure that this never ever happens? And so I really felt a calling for the first time in my life, more of a spiritual calling. I do consider myself, I am a Christian. I believe that, I follow in my faith, but never felt it so profound. But I didn't know what it meant. So I started to inquire about how do I change the world for the better, build a company that can do good, but also think about how do I bring my values into this in a way that I have not done so before. So, in short, I joined a program called Amplify by the National Christian Foundation, and it taught me a 9-month program on how to be a purpose-driven organization. Um, so that's why when I said it goes much deeper is because literally I took a 9-month course on it, and it's so hard to put it together in a few minutes. But I will say it starts and ends with think about the value you want to bring to society. What is the thing that you want to create the impact most, and then how does that trickle into every part of your business? For example, you want to do good, but Mama always said, charity begins at home, right? So think of your employees. How do you better the lives of your employees through through your company? So simple things I've done is we do now a quarterly, day retreat where a chaplain comes in and actually starts with a prayer. And by the way, I have Muslims and Jewish employees. I have them all. And yet everyone embraces the fact that we could all be grateful. We could all live better lives, that sometimes having somebody to talk to as we're going through the stresses of building a company. And so having that retreat to really think about, what we're doing and our contribution has been a game changer. You know, I thought it might be difficult at first, not all being from the same religion and so forth, but absolutely, it has been a game changer in the culture of our company. People are freer to bring their faith into our conversations, which was a beautiful thing to see. Saying have a blessed day is okay in our company. Then you look at my investors. So I've raised a couple $1 million so far. I have 2 more million to go. So I had to make a decision of who I wanted to impact my company. So I made a very bold decision to be selective in who I invite to contribute and to invest in us. And so now I'm on a journey to meet like-minded investors who value what we're trying to do and put people before profit, and will understand that I am programmed to build businesses that get acquired. I will never change who I am as a businesswoman in the sense that I am determined to build a unicorn here. I've never built a unicorn, by the way. I've built profitable, very nice companies, but never a unicorn. So I want this to be a lesson that you could also build a unicorn and still
Mhm.
be very impact-driven organization. So I have a higher purpose even to what I'm doing, which is, to help people, but to show and demonstrate that those type of companies can be hugely successful. So now I have impact investors. 80% of my investors, the first 20% came from family and friends. So I consider them, they're friendly investors, right? They know what I'm doing, but I've turned away hundreds of thousands of dollars from investors who wanted to have a controlling say in how I ran the business. And so that you have to be brave to do that when you're a startup, especially in this economic market. Um, but I have a lot of faith that I will continue to find them and they will continue to find me. I and then I look at my clients. Who are my clients? And how do I make their lives better? And that is a very individualized approach. So we talk about that as a team. How do we help our clients live better? And most people think of how do I build the best product for my clients, right? So that they are successful. We take a little different approach. How do we help our clients live better? So we look at a very holistic approach to who our clients are, what their needs are, and how do we help them. Helping them by giving them a successful product is probably on the top of their list. But believe it or not, they've embraced a lot of our conversations that have gone beyond the business to business part.
Yep.
And then I look at the customer, our end user. And as you said, Andrea, our customer are people who are on medications or loved ones who are on medications. And that we've had the most fun with because we built a product that truly makes a difference in their lives and helps caregivers like myself avoid those traumatic situations and readies them to live their life out fully and more healthy, but also such a peace of mind for people who care for them, whether they're near or far. So I take that four-prong approach to being a impact company.
You're a smart woman. Um, did this all come from one of those epiphanies that you had? Did you have mentors? Was there something you read? I often tell people to stay open, hear what others are saying. Don't judge them, but listen carefully. It isn't what they say, sometimes it's what they mean, it's what you hear. And often we don't hear what they really meant, but there's something going on inside us, like your mother being sick and not knowing where her medicine was or what she had taken. That became a cataclysmic moment. But I'm often preaching to others to surround yourself with others, to find a mentor you can talk to honestly and safely. Give some how to build the kind of input of ideas that can help you begin to craft something unfamiliar and very, I'm a blue ocean strategist. This is a very blue ocean. You're opening a whole new market space, both what and how. Am I right?
So um, when I got the call, I got on the call, and for those who know Florida, I went on 75. We used to call it Alligator Alley, and I sped all the way from Fort Lauderdale to Fort Myers. And I got there, and I kept on saying, 2 years ago, they gave my mom a dye that almost killed her. And I told them that, and it was at their hospital. So I was very disappointed they didn't have a record of what that dye was. You would think, right? But they didn't. So
Welcome to the
I
world of
kept,
healthcare. I
yeah,
mean, that's crazy.
welcome
Yeah.
to our healthcare, right? And so I said to them, if you give them the dye, you can kill her. They said there's 11 dyes. Um, we don't have no idea which one she almost died from. But if we don't give her the dye to see where the blockage is, she'll die anyway, right? So we need to put her in there. So when I got to when I finally arrived there, I was escorted to a waiting room right near the surgical area. She was in the OR. And I hear the code blue. I She was dying. I knew it was my mother. You know when you know it's you just know it. And I said, that's my mother dying right this second. And I started to pray like I've never prayed before in my life.
Mhm.
And I said, God, you blessed me over and over and over again. And I don't think I've ever truly asked you what I can do to give back. But I promise you, if you help my mom survive this, that I will do everything in my power to use your direction to never let this happen to another human being again. And so the doctor came out 45 minutes later, all sweated, and he said, I don't know what to tell you. You got a miracle on your hands. I'm going to tell you, your mother did flatline on the table. And she was at the time 83 years old. He goes, we got her back. He goes, miraculously. And her heart is like that of a 20-year-old. He goes, you're lucky. And I said, I'm not lucky. I have a new job. And I said, I have a new job. But I didn't know what that meant. And I think a lot of your listeners will really understand my journey, because when you're faced with something you've never understood before and you've never done this in business before, you don't know where to begin. And I was 60. So these are a few years ago. I turned 60. I should have been thinking of retiring, but I knew I had it in me to do it one more time because he's blessed me with a Rolodex, and I'm aging myself now, but a Rolodex to die for. I mean, I can get to just about anybody. And I'm like, okay, now it's time to turn that on. And I did. And I was invited by a friend of mine who listened to my story and said, you need to come to this meeting. It's called a redemptive dinner that the NCF puts on, the National Christian Foundation. And I went not knowing what the heck is a redemptive business or redemptive dinner? I didn't know anything about it. But when I got there and listened to these five leaders in the industry talk about how to build a business of impact and redemption, I became overwhelmed because it was the answer I was looking for, that there are people who could help you and steer you in that direction. And I do encourage people to look into that. There are so many books on building a company with purpose, on faith-based driven entrepreneurs. It just allows you to think a little differently. But I have to tell you, I think there's a movement out there. I think there's a movement, and anyone can be part of that movement if they're committed enough to take that journey, which is not always the easiest one.
Well, and you don't need to have a life-altering experience to be a catalyst to do it either.
That's right. That's right.
I mean, you can learn from someone else's experience, but realize, and this is something you have to feel. We decide with the heart, sometimes with the gut, but it isn't about a data, and it isn't about the bottom line. You need one, but this is about finding meaning and matters and purpose beyond me. It's about we. It's something I can do better for others because of who I am, and I have the good fortune to do that. So out of all of this came my cabinet. Tell us about how you start a business like this. How you I mean, I've heard what you said a little bit about how you let your purpose thrive through all of it, all parts to it. Share with the listeners now, if you want to do something like this, here are the 3 or 4 or 5 things that I would suggest you do. Can you do that?
Yes. So, like I said, never built a technology company. So I'm a SaaS-based product, which, by the way, is phenomenal because our margins are ridiculously high. And you're talking about like 96% margins, right? But building the company is really you have to find your product market fit. So the first thing I always say is, who's going to buy your product? Who's going to write that check for your product? That's critically important. So as you're creating your concept, not even going into prototype, you need to determine what the need is. You must do a very thorough competitive analysis to understand what is your fit that the others do not. It could be the same fit, but you just do it better, right? Building a better mousetrap. The status quo could be so antiquated, even though there is a fit, that you're like, why are people settling for that level of standard, right? How do you bring and disrupt the marketplace?
Yeah.
Like I said, just disrupt the standard that could be at that point dated because technology moves so quickly. I don't think you could build a technology company today without thinking about how to integrate AI into your product market development. Otherwise, your investors will think you're antiquated, right? So there's a lot that goes into building a technology company. Once you determine what you think is your product market fit, then you need to go out and get your first customer. And in a perfect world, you would get your first customer before your product's even built or completed so that they can become an early adapter and take some ownership into the development and future, of your product, which is we've been fortunate enough to get, right? We had people who said, believe in what you're doing. We can be part of that. Everything from national health plans to big school systems. So we were very blessed, but it didn't happen overnight. Okay. I had to meet with a lot of people, kiss a lot of frogs, right? I just had to, it's exhausting. But when you find that person and that company and that person who believes in you, you foster that relationship, and you just keep on letting them be part of the vision, so that they become really they become vested in then the success of the product. In my case, before I even brought it to market or even brought it to, I made sure I was patented in the US. And because in technology, how easy it is to just steal an idea.
Yep.
So I was able to get a both utility and design patent for my cabinet, which looks and feels just like a medicine cabinet. When I first worked with a gentleman from Procter and Gamble to create it, Cliff Francis, he's a genius. I said to him, somebody must have this. But when we looked into it, no one did. So we were very fortunate to have an innovative, disruptive design that is in everyone's home. We just created, you have TVs that became smart TVs. You have telephones that became smart telephones, refrigerators that became smart refrigerators. Why not have a medicine cabinet that became a smart medicine cabinet, right? And
Right.
so that's where we fit and developed some patents worldwide around that. And then I felt very comfortable taking it to market. Um, and then once I brought it out there, I will tell you, be prepared. Depends on your industry. Some move faster. In healthcare, it's painfully slow. So I needed to know, and my investor needed to understand that you're looking at 2 to 3 years before you have, enough in the pipeline to even see the profitability long term. So, you have to have the planning correct according to your marketplace. When I built publishing companies, it was much different. When I had media companies, much different. I could have a business up in 3 months with paying clients. I'm talking about $1 million in paying clients within 3 months. In healthcare, you're looking at 24 months easy before you get a paid client. So, know your market, know what you need, and have the perseverance and the bandwidth to be able to sustain that.
Now, do you sell, is this B2B first or B2B is to B to C? Or are you going direct B to C?
Oh, what a wonderful question, Andrea. When I first launched, I thought I was B2C. Okay. And this is why it's so important for entrepreneurs to listen to others, because I thought I was B2C, but I've been through it enough to know how to pivot quickly. So when I put the business plan together and I said it's going to cost me tens or hundreds of millions, like look at him and hers, those that pharmaceutical company. They had to raise a half a billion, and then I think they raised another half a billion. I mean, like just to compete in the B2C market. I didn't have the bandwidth to do that.
Yep.
Okay, I just didn't see it. I didn't think I had the relationships to do it. So I knew my shortcomings and thought, okay, how do you get there faster? So if it's going to cost me $50 million to acquire, a couple 100,000 users, what if I find a client that could deliver a couple 100,000 users? And so I pivoted to B2B to C.
Hmm.
Best decision I ever made. But now you got to start thinking, who do I know in that industry? And I didn't really know the health plan industry well, so I had to hire people who did, right? I had to bring advisors in. I looked for investors. I have the former CEO of Aetna as one of my investors. And I said to him, yes, I appreciate the money, but I really need your ear. And so he opened doors for me. So you have to be very strategic.
Well, but strategic is a great word. So many entrepreneurs understand something, a product, a need they want to fill, an idea they have, something they saw, without the scope of really understanding how to understand it. I mean, I use that word incorrectly here because you don't want to understand how to understand it, but in fact, it isn't simple. I mean, it isn't simply that I've got this thing called my cabinet and I can put it in people's homes and their children will know what their parents have in the cabinet. I mean, that's my story, but that's really not the story at all because what you're doing, and remember, I'm a blue ocean strategist, you're creating a new market. That's just what blue oceans do. You're not competing. There's nobody out there like it. Perfect situation. But now a whole new business model is needed to figure out how to get others, to market it to others, to get them to use it. Certainly, the end user isn't lining up and saying to Aetna or anybody else, I need my cabinet so I can manage my medication. I don't even know that I could get a cabinet, much less manage it. Nobody walked around saying, I need a smart TV, but there it was. And there you are. So, for the listener, think carefully about what the story is here, because what Delia has done is taken a great idea, something she observed, turn it into an innovation, true, but then figured out how to make it come to market, not in the way you might have anticipated, but in a whole different business model that now is beginning to thrive. How long have you been in this business now? 2 years?
So the napkin design was 3 years ago, almost a year and a half in research and development, getting the patents, all of that. And then, we brought it to market September of 23.
Yep.
So I have to tell you, it is not easy swimming in the blue ocean
Yeah.
because
Tell me
people
about it.
tend to have they understand product market fit because they've either used it or they've whatever, but then you bring something disruptive to the table and they go, what do I do with it? I don't even know where to begin. It's a perfect example. So we had a call this morning with our health plan client, and it's one of the Blue Cross Blue Shields. And we said to her, we can do better, but we can't do better alone. We need to know where your pain points are.
Yep.
And so she said, every health plan wants to go from a 4-star to a 5-star. Let's figure out who's holding us back from
Yep.
going from 4 to 5 star. Usually those people are the people that have the chronic illnesses,
Yep.
right? So then we said, can we come and meet with you? Can we do a half a day with you, whiteboard who that pain point customer is and what my cabinet and what our capabilities are to help you, attack that particular challenge? And she said, absolutely, come on in.
Uh-huh.
That's the position we took, not I have a solution and I'm going to ram it down your throat because this is a better way to do things. We
No.
said, we have something.
Yeah.
We need to figure out what the actual solution will do to reduce a pain point, and that we can't do alone.
Well, and so I'm going to follow up because I have a bunch of blue ocean strategy clients. The world we're in today is very disruptive, and they're coming in to see how to grow their business, not profit and for profit, in a world that's disrupting. And all of a sudden, Blue Ocean's 20 years old, and I've been a Blue Ocean strategist for 20 years. And in the process, your point is essential. It isn't what you have or do, it's what they and their customers need. And these are the unmet needs that you have a solution for only if you tell it in a story form that can be easily understood both by the company, the healthcare company, and those who they're serving, who don't know they have an unmet need. They just know somebody is making it hard for them. And we have to take the pain to go away. This is such an exciting story to tell from many levels, not the least of which is I love to preach blue ocean, but it doesn't fit. That's the whole point of it. You're not thinking out of the box. You're creating a whole new sandbox. And
Yeah.
you cannot do it alone because you are imagining and they have no idea and they're thinking, but they don't really know. And all of you are trying to figure out what that chronically ill person could really use to make
Right.
it simpler. And it isn't just that person, it's their family because you become the model for it wasn't my mom who needed it, I needed it. The doctor
Mhm.
needed it. And so we have a very different model coming. And creating demand is not the easy part, it's the hard part.
The hardest part. And also getting people to do things slightly different or
Yes.
bringing in new vendors or revisiting their model. It depends on the industry, but good luck because we all need it. But that's why I believe that the best way to do this is to find your own ambassadors, your own cheerleaders, your own advisors who open doors for you. Everything that has happened to build toward our, potential success, because we're a startup, right? We're not profitable by far. So I consider us, we've had moments of success along the way, but that's not the test of time. The test of time is when we have millions of people using the cabinet and then we're delivering back, really strong adherence numbers, right? That's going to be our test. But until then, we need to find those people who believe in us,
Become evangelical. You need
and
evangelists, right?
evangelists. They believe so much in our mission that they're willing to go the extra mile. They're willing to take it to their senior people and go, but I want to do this,
Yeah.
but will you give me the money? Will you give me a pilot? Can I just test this? Can I just give me enough to make a case, but not enough to break the bank, right? I used to say we're a rounding error. Just think about us. You pay that much in toilet paper. Can you give it to me to prove what I can do? And put it in a way that they understand everyone wins here, because the data I will bring you, no matter what, will help you get to a better place with your members. And I'm talking about insurance plans. But I will tell you that the key is getting out there. I have to tell you, my daughter is decided to open a med spa. And I told her, I said, you're doing something that you love, you're so passionate about. I said, but you also now have to put your business cap on for the first time. I said, be prepared to starve for the first 2 years. Can you afford the rent? Can you do this? Can you do that? And if you're going into technology, you have to have pretty deep pockets,
Mm-hmm.
because nothing, there's no quick success story key here.
Nope.
No.
Now, you and I could talk a great deal about this mission, purpose. We haven't even talked about it very much, but we've talked about it. And it's an interesting way of showing how a business, my cabinet, can emerge from a purpose and yet not be so consumed with the mission that we can't understand the business side of it. They aren't separate. It's a platform to grow on that is because of the people who are bringing you in to do that one day whiteboard for those chronically ill folks, understand the mission somewhat, but they have another purpose as well. And this is really a wonderful way to make it, I'm going to say, human. People caring for people and trying to find better solutions. Give our listeners one or two or three things they should walk away with, because we're just about out of time. I
Okay.
loved having this conversation. Thank you. What do you want them to remember?
You cannot do this alone. So the first thing that I recommend, well, I don't care what stage you are. Okay. Seek out new advisors, but go out of your comfort zone a little bit. All right. I decided for the first time in my life, I'm a very non-political person. I sit right in the middle. I'm very not political, but I decided to reach out to politicians, not my comfort zone, and um, and share my story. And before you know it, they're opening doors. How can my cabinet change the foster care system? How can my cabinet change the prison systems, their healthcare? How can my cabinet do more in the schools across? Unbelievable. It was probably the most uncomfortable thing for me to do, is to start reaching out to politicians, but I found it to be the most rewarding. So my thing is, get out of your comfort zone. Okay.
Yes. But
And
follow up this for one thought. Those are not a direct line from I have this thing I can sell to them, because this politician you're not selling them anything.
I'm
And
not
all of a
saying,
sudden you're telling them a story That's opening up a door that had if the door didn't open, you couldn't go through it. And next thing you know, all the doors are opening through a process that you didn't even anticipate.
That's
So
right.
perfect story. Another one. What you
Yeah.
got?
Surround yourself with people who, I'll leave it with dot, dot, dot. You answer that question. Who do you need to surround yourself with? Sometimes you need people who are with the same mindset. Sometimes you need people who will challenge that mindset. And then you need people who will never challenge your mission and your purpose. Okay. That you do not want because you need your North Star. But that doesn't mean your North Star can't shift
Mhm.
to be even stronger and brighter, but it's with the right people who, dot, dot, dot. Leave that to you. But I do think that that's a question I ask myself repeatedly. And then I go and find those people and be prepared for the unseen. It's very hard to be a woman business owner and raising capital. For those women who are out there, there is a disproportionate when it comes to being able to get venture capital. So I've been told that I need to find a male co-founder, because I'm much more likely to get funding without having a male partner. And they're right, but I chose not to. Um, I'm going to challenge it a little bit, but they're absolutely right. Women who try to raise money on their own are going to have a much harder time, 40% more likelihood of raising funds if I have a male partner, blah, 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 blah. But I want to be that example of you can do it. So be prepared for the unseen. It might not be as easy as you think to raise the capital. You may need more time in your business than you thought to actually get that first sale.
You need to know what matters to you. I mean, what you're really saying is, yes, you can, but what matters? And I love the way you've chosen the things that matter the most. If they want to reach you, Delia, where can they reach you and where can they find out more about my cabinet?
Yes, please do. I value every new relationship. So you could reach, well, through our website, mycabinet.com, and it's all one word, mycabinet.com. There's a contact us. So if you'd like to reach out to me and my team, we'd love to hear from you. If you'd like to reach out to me personally, I have no problem with that as well. Passi at mycabinet.com, and on LinkedIn. I'm
Yes.
very active on LinkedIn. Just make sure that you mention that you heard through this podcast,
Yeah.
because especially in your note to me, direct message me. I'm much more inclined if I know people have vested their time to get to know me. So because I do get like 20 a day things to request, so I try to prioritize and learn to say no sometimes. But I do welcome that in a big way.
Delia, it's been a pleasure. I'm going to wrap, and because I've enjoyed every minute, but I do know that you and our listeners are ready to move on to your next conversation for the day. It's been a pleasure. For those of you who come, send me all of your emails at info@simonassociates.net. I too am on LinkedIn. My books are all on Amazon. Just look for Andi Simon there. And it's always fun to share. This is a situation where Delia took her observations and her life experience and turned it into an innovation, and now has learned how to innovate and change it and respond and innovate and change it and growing a business. And my cabinet will be in your cabinet before you know it. It's been a pleasure. Thanks again for coming. What fun. Bye bye now.
Bye bye.